Who amongst you all have seen this movie Unchai? भाई यार lightweight बंद कर. Unchai actually a couple of friends, हमारे एक friends की daughter ने actually ये movie बनाई थी. And I think you know there is Amitabh Bachchan, Boman Irani, Danny Deonzangpa, Anupam Kher. At that age, they decided to go for Everest camp trek. So basically, they had the gumption, courage to follow their dreams. I am asking you, do you want to play around with your grandchildren or do you want them, bhai, pointer? No. Or do you want your grandchildren to look after you? So today I am trying to teach you how to spend your sunset years or second innings. You should go through the concept of shift your focus from lifespan to health span. Health span is the period of good health, free from chronic disease and disability of aging. So that the tree of life remains as tree of life and not the tree of all these diseases. Dr. Ketan Mehta is the president and he seems to be one of our metabolic physicians. I was happy to ask him to hold this meeting because the importance of metabolic or lifestyle diseases was very close to his heart, and he gave me these slides telling us how we have progressed as a species from hunter-gatherers to sedentary lives. And some of his slides are interesting for us to know that how we used to play earlier and now how we are playing. Walking the dog, of course, has changed drastically. Saviors of nation have also changed. Now we don't waste any time and we believe in spending quality time everywhere. And obviously, lifestyle diseases come with their friends and the relatives all together. We know that almost 70% of global deaths are due to lifestyle diseases, and unfortunately 80% of all premature deaths are attributable to just three main factors: poor diet, as we had during lunch today, lack of physical activity as we are all sitting for 3 hours doing nothing, tobacco and alcohol consumption fortunately is not allowed in IMA premises. Bad food kills more people than terrorism. 1 in 5 deaths globally are due to dietary habits. A lot of people talked about the dietary habits, and Dr. Bhandari talked about low consumption of healthy foods, and 2 million people actually are dying due to high salt diets. But why am I wasting your time? Mainly because India is facing an epidemic of NCDs. More importantly, Indians are dying early and prematurely when they should be actually they are actually the breadwinners of the family. You don't die. If you don't die, you are lucky that you are not dying, then you need money for kidney transplant, liver transplant, angioplasties, bypass, TKRs, managing all these critical illnesses, which are the end results of all the non-communicable diseases. Unfortunately, we are both genetically and culturally prone to develop non-communicable diseases. Being Indian itself is a risk factor. We would have failed our children if we don't act now and don't act fast. Also, these diseases were once a prerogative of elderly and today it is of young generation. They were once in only urban, now they have gone to rural population. They were of the rich and the affluent, but now they affect all strata of life. So friends, the urgency is genuinely there, which is why we are wasting your time here, into inverted commas. What is the disease burden? We all know 1/3 of people sitting in this audience are hypertensive. 1/4 are either pre-diabetic or diabetic, and 1/5 are our overweight or obese, and I'm not talking of 1/10 have CKD. There are modifiable risk factors which actually is the reason why we are talking, and if we really modify them, then it would help. The consumption of unhealthy foods in India has increased drastically. Salt intake from 8 to 11 grams, I think some surveys are talking of 10 grams, 11 grams, 8 grams. But the unfortunate part is, although we are blaming pizza and pastas, 80% of this intake comes from food prepared at home. Hamara culturally it is that habit that when we used to serve food, salt and pickles and chutney and all that is a part of, first that is served and then food is served. And of course at the end we cover it up with papadam. So the cultural problems have to be also tackled apart from blaming the Western culture and Swiggy and so on. We also need to take care of our own culture. The fat intake of course has gone up. Processed food is by itself a huge problem. Eating out, 1/5 of adults reported eating food prepared outside. IMA भी twice a week तो IMA में आके भी खाते हैं हम लोग. Sugar intake has gone up drastically. Ultra processed food, because of lack of time, I have to cut down by 5 minutes, but we will talk of ultra processed foods only by way of photographs. But they are in chocolate, sugar confectionery, salty snacks, beverages, convenience foods, that healthy cereals, the sauces, the dressings, the frozen seafood and so on. Breakfast cereals to bahut ullu banaya gaya hum logon ko. The processed foods actually contains a lot of emulsifiers, sweeteners, food colors, microparticles, and have obesogenic properties, but more importantly, carcinogenic properties. We keep on talking cancer ka both rate बढ़ गया, CKD बढ़ गया, but you know why it has increased. So what should we do? Problems to both बोल दिए. What is the solution? The solution is, from today all of us will practice lifestyle medicine also. We have been practicing a lot of guideline bills, pharma industry sponsored, and whatever we've been taught in our medical science, the therapy with pharma. We need to change our focus to practice lifestyle medicine, which should probably come as a subject in our curriculum. Desmond Tutu very nicely mentioned that there comes a point where we need to stop just pulling people out of the river. We need to go upstream and find out why they are actually falling into the river. Don't allow them to fall in the river. And in the current healthcare system, doctors are not trained to get involved in the initial reason why they are falling into the river. And we all know the four, everybody knows Warren Buffett, I think. And he has talked about the power of compounding, which is the 8th wonder of the world, which means that lifestyle diseases will also follow the concept of compounding. Minor risk factors over the years will get compounded into the unstoppable asymmetrical catastrophe called NCD. So start practicing lifestyle medicine from today, which means we will be telling you of evidence-based scientific evidence to tell you how these lifestyle disease or alterations in your lifestyle can actually help in reducing the CKD or NCD epidemic. So what you need to basically convey to your patient is about diet, weight management, sleep hygiene, smoking cessation, in the physical activity, what activity, when, how much, and so on. But ये सब ज्ञान देने का, but does lifestyle medicine work actually? Which is what is important. And how does it work? It works by the principle of epigenetics. The epigenetics is changes in organisms caused by modification of gene expression rather than the genetic code itself. We all say that you are based on your grandparents' genes, but it is also important as to what your grandparents ate. It's not that diabetes, heart disease and obesity runs in your family. It is because no one runs in your family. So epigenetics is an important part which we have to understand. And in epigenetics, the genes are not your destiny, your lifestyle is your destiny. And you change today will change your future because the expression of genes will change. And there is enough evidence, like about diet, about exercise. Physical activity actually alters gene expression of the GLUT4 receptors and improves glucose uptake. Sleep also changes the gene expression. Obesity alters gene expression. So it's not talking through my hat, but there is actual scientific proof. Genes explains 10% variations health, epigenetics explains 70 to 90%. And there are many studies, and because of paucity of time, we will be talking of just a few studies. The DPPO study, the Diabetes Prevention Program, said that diet, exercise significantly reduce the risk of developing type 2 diabetes in high-risk individual by 58%, while drugs, metformin, reduced by 31%. Similarly, This persisted for over 15 years, the lifestyle intervention, while the metformin intervention only for 27%, lower incidence. So 27% with the help of lifestyle and 18% lower with metformin, which tells you how lifestyle scores over it. The Ornish trial is a very old trial and it's a lifestyle hard trial. So remember, the old trials are actually consistently telling us how lifestyle works, because the new trials are done by pharma industry and nobody wants to do many trials on lifestyle diseases. We all have been taught on the lecture on hypertension, physical activity reduces blood pressure by 4 to 9, DASH eating plan 8 to 14%, salt restriction up to 8% reduction in BP, and so on and so forth. So there is evidence to show that all these lifestyle changes will help you to treat your illness. And today's guidelines at least mention in passing that all chronic disease management should be started with lifestyle change. It's up to us, the emphasis to be given for the lifestyle changes. And what are these lifestyle changes? 6 pillars of lifestyle management, and we all know them: nutrition, physical activity, sleep, avoidance of risky substances, stress management, and social connections. Nutrition, again, DASH diet is easily shown that evidence to show that it lowers the risk of adverse cardiac events, stroke, type 2 diabetes, and obesity significantly. Diet high in fiber and vegetable consumption can reduce by 20 to 25% decline in the risk of ischemic heart disease, ischemic stroke, hemorrhagic stroke, esophageal cancers. So enough evidence from that. We all have been talking about gut microbiota, and because of so many probiotics now available in market, this has come up as a very interesting and important topic for people to contribute in terms of changing the gut microbiome. Advanced glycation end products are now known to be the cause of many diseases like diabetes, atherosclerosis, kidney disease, and so on. And food preparation can actually affect your nutrient value through oxidation and more advanced glycation products. Dr. Bhandari just entered into this room, and I have put up this slide which they have so painstakingly made ICMR NIN guidelines. Because when I tell you that you make your changes, you will ask what should we eat? So the ideal healthy diet has also been prescribed by ICMR NINs, and we must all go through it. We will ask IMA to forward to each and every member who is sitting in this audience what is this ICMR NIN guideline, so that we eat ideal healthy food. Sleep, again it will change T cell, so it will change immunity and inflammation, circadian rhythm, and so on. So I am talking of science, I am not talking through my hat, the importance of all this. And the great Indian sleep deficit is all over the place. We believe in spending 12 to 16 hours in work, and of course we all are on social media, which is affecting in a big way. But more importantly, in the youngsters, the social connection, emotional well-being being lost, that itself is a very important issue. There is something called eudaimonia. That means you have to find the meaning and purpose in life, which is a protection against Alzheimer's, stroke, myocardial infarction. It reduces stress hormones, inflammatory markers, and helps in gene regulation. Remember today epigenetics. Every time you will wonder, will health style change or lifestyle change help us in any way? Yes, through epigenetics. It down-regulates the pro-inflammatory genes, it reduces the activation of amygdala, and so on. Physical activity, we all know, 150 minutes of a week of moderate intensity physical exercise, or 75 minutes of vigorous exercise. Various forms: cardiorespiratory endurance, muscular strengthening, flexibility, mobility, call it yoga, call it cardio, whichever way. It's unimportant as to which way you are practicing your exercise, but it is important. Sitting is the new smoking, we all know. Physical exercise, the trials are there, but because of lack of time, I will not talk about it. Yeah, I think the STRIDE studies of targeted risk reduction intervention through defined exercise trial has actually shown the importance of exercise in reducing the burden of coronary artery disease and cerebrovascular disease. Yoga and lifestyle, unfortunately not many studies have been done of yoga and lifestyle, but whatever few studies are there, it shows that it reduces fasting, PP, HbA1c levels, body weight, and so on. But instead of having a sound scientific basis of yoga and lifestyle, we are going by the fact that from generations, yoga and lifestyle modification through yoga and meditation has helped in so many generations. So most likely anything which has helped over the years has to be good, except that we need to do more studies to confirm it. Smoking, only about 1 cigarette per day can carry a risk of developing coronary artery disease and stroke much greater than expected in 50% of the people who smoke 20 cigarettes. But 1 cigarette is also enough. It is never too late to stop smoking. 5 to 10 years of quitting, after that also your chance of getting cancer of the mouth, throat or voice box will be there, but it will drop by 50%. Now this case study I will not go on through, because this is an actual case study of how lifestyle modification has helped somebody in completely changing the metabolic profile of somebody who was 110 kg, NASH, NAFLD, early cirrhosis and so on. But I think I have to lead from the front and see that I don't take too much of your time. So this case study actually tells you of exercise, diet, social connectivity, sleep. When you change all that, on follow-up period after 8 months, the bloating symptoms of GERD disappeared, urticaria, itching went, 23 kgs of weight loss, change in the laboratory parameters by liver enzymes, OT, PT improved over 3 months, and total cholesterol, LDL, everything reduced significantly, which would have been otherwise difficult. So to summarize, cardiovascular disease account for most NCD deaths, tobacco use, physical inactivity, harmful use of alcohol, unhealthy diets, and air pollution. Dr. Vijay Kher keeps on traveling out of Delhi, because if remains in Delhi, there are 5 cigarettes per day is the AQI quality of Delhi, and fortunately in Mumbai he will be facing only 2.5 cigarettes per day, and therefore it's always a gain. Salt, there will be 3 more lectures. HFSS and UPFs, this is the new terminology everybody has to understand about diet. High fat, salt and sugar, and ultra processed foods, and this is where all the problems lies. We should start practicing lifestyle medicine today from now onwards. And of course we have to remember Gandhiji many times in life. Remember, there is nothing called a sudden heart attack. It requires years of preparation. And the time to repair the roof is when the sun is shining. This is what John F. Kennedy said. And if you see on the left hand side, there is a young guy who has all the time in the world, very little money, lot of energy. And the middle level guys with lot of people in this audience, they have no time, money significantly, good energy. But a person like me has all the time in the world, decent amount of money, but no energy. So I will be failing in my duties if I don't tell my primary physicians, doctors, as to how they should practice their life and their lifestyle. And I will end by giving you a toolkit for healthy living. Move. For heaven's sake, move. Be physically active. Eat less, eat smart, eat sensibly. Follow ICMR NIN guidelines, and we have the maker of ICMR NIN guidelines sitting here. Sleep well, but not in the IMA class. Calm your mind and build cognitive reserves through yoga, meditation, hobbies. Avoid substance abuse, tobacco, alcohol, drugs outside the IMA hall also. Be aware of your weight and caloric intake. We'll request IMA to put on a weight machine also outside. Avoid abnormal environmental exposures. Go out of Delhi and Mumbai. Calculate your CVS and metabolic risk profiles periodically. Listen to all the talks which are happening in IMA. Take your vaccinations regularly. And Mumbai Kidney Foundation, in fact, has started a campaign of free pneumonia vaccine, free influenza vaccine, free hepatitis B vaccine in 1 or 2 places in our area. Look after your bone health, especially females. Osteoporosis, DEXA scan. Avoid falls. Once you have fallen, fracture neck, femur, a lot of people don't make it. Screen for cancers. Get your medical insurances in place. Make your living will and financial will. So friends, why am I standing in front of you today? Because a primary care physician has the reach, the ability, the depth of penetration, and the power to practice lifestyle medicine. He only needs a strong desire to make a difference, and really you can touch many lives. So the last slide is about Gukesh, who rearranges all the pieces back on the chessboard Let us all rearrange our pieces on our life's chessboard in the form of regular exercise, yoga, meditation, sleep, rest, mindful eating, social connections, and avoid wrong moves. If you do the wrong moves of smoking, alcohol, and idhar udhar ka bishop, idhar udhar hila dene ka, then you know your life will be ding dong and you will be checkmated. I have pledged to join the Ek Chammach Kam campaign, have you? And if you have not, at least change your spoon to this kind of spoon. Thank you so much.